Hi, I'm Michelle Leifer. I'm the director of the Usdan Institute for Animal Health Education at the Animal Medical Center. On behalf of my colleague Kimberly Young, I'd like to thank you all for joining us for tonight's event, Travel and Summer Safety with Dr. Carly Fox. Tonight's event will be recorded and we'll send out the link tomorrow, so in case you miss anything or would like to watch it again. Dr. Fox has a great presentation plan covering a wide range of topics, so we ask that you please save your questions until the end. We'll be taking questions via chat and get to as many as possible. And I'd also like to just take a moment and let everyone know about two of our upcoming events. On Thursday, June 10th at 6 p.m., AMC's Dr. Leilani Alvarez will join us to speak about arthritis in dogs and cats. And the following week, on Wednesday, June 16th at 7 p.m., we'll host our very first book club event. And we're thrilled that CBS News correspondent Martha Teichner will join us to discuss her New York Times bestseller, When Harry Met Minnie. It's a beautiful story about how a chance encounter in Miss Teichner's life led to deep friendships between people and between bull terriers. You'll find more information about both of these events, as well as the links to register, in our newsletter that goes out tonight. And you can also find it on our website, which is www.amcny.org/events. And now I'd like to introduce tonight's speaker, Dr. Carly Fox, who is a staff doctor in AMC's Emergency and Critical Care Service. Dr. Fox earned her undergraduate degree from Cornell University and attended veterinary school at Ross University and Cornell University, graduating in 2009. She completed a rotating medicine and surgery internship at the Animal Medical Center in 2010, and then joined AMC full-time in the Emergency and Critical Care Department. She's proud to work in one of the busiest veterinary emergencies rooms in the world, and it is very, very busy. And we are so grateful to have her with us to lead tonight's event. It's my pleasure to welcome Dr. Carly Fox.
Hi, everyone. Michelle, thank you so much. Kim, thanks so much. I also love the idea of a book club. Love it. Excited. Okay, we are going to get going with the presentation because I have a lot to say. Okay, yeah? Okay, perfect. Excellent. So, okay, good. Today we're going to talk about travel safety and then go into summer safety. A lot, of things to just touch on with travel safety, since everyone is emerging from their homes now that it is summertime and now that the pandemic is lighting up. So we're going to talk about traveling by car with your pet, which I think a lot of us are doing nowadays. I know my family actually got a car during the pandemic, so we are traveling a lot and our dog is traveling a lot with us, and I'm sure that's the same for a lot of you guys. So most importantly, when traveling with a pet in the car, you want to make sure that you get them a very comfortable crate or carrier. And I think this goes especially for cats. I think people forget to even have a carrier for their cat in a lot of cases, but definitely when you're traveling in the car, a carrier is very important. They make a bunch of carriers that actually buckle into the car nowadays that you can find on the internet, and they're very travel safe and also very comfortable for your animal. It should be large enough for your pet to lie down, to turn around and stand up comfortably. I cannot tell you how many animals come in carriers that are inappropriately sized for them while in the hospital. So that, especially if they're traveling long distances, stand up, turn around, lie down, and just be comfortable. Okay, especially for dogs, and definitely for cats who aren't used to being in carriers. And as far as cats and small dogs go in the car, they're more likely to want to be on your lap, want to, scurry on the floor, get underfoot, get under the pedals that you obviously need to drive the car, and that can cause major accidents. And I highly recommend crating them, even though I think a lot of people like the idea of them on their laps while they're driving. It is obviously very, very dangerous. A great tip prior to traveling is allowing your pets have access to the crate prior to the trip, don't just introduce your animal to the crate as soon as you get in the car, which is also in a lot of times a new experience for them. So you're like, here you're going in and traveling in the car, here's your new crate. You have to be in it for many hours, like get used to it. It's much easier for your pet and for you if you allow them access to it beforehand, whether it's like in your house or apartment, or if you actually just take them on like mini trips around the neighborhood, it actually will get them used to traveling much better. They'll be happy to get in the crate in most cases, and definitely just be less stressed. And if you're unable to crate your pet, just like a large dog, really, make sure your pet is secured with a seatbelt or an animal car seat. Another note about animals that stick their heads out of the car window, dogs especially, obviously. I think when we all see it when we're driving, we're like, oh, look at that, that's so cute. Well, as a veterinarian, I think of all like the terrible things that can happen. Of course, a dog can jump out of a moving vehicle and be very hurt. I've seen many dogs in the emergency room for that reason. They can have debris flying at their face, at their eyes. They can get ulcers. You don't want to be in a place where you're unfamiliar and then, you know, your dog can't open its eye or something like that. It seems like it's minor, but you're going to need to seek veterinary care, and it's just so avoidable by just not allowing your animal to stick their head out of the car. Of course, you never want to leave your animal in a parked car, and we'll talk more about that in the second half of the presentation. But actually 31 states have laws against leaving your animal in an unattended vehicle. I don't know why it's not all the states, but 31, better than nothing. Okay, traveling by plane, and now a lot of people, we're just traveling by plane now, or at least we're feeling a little bit more comfortable with it. And as we travel, I think a lot of people are planning on taking their animals with them. As far as carriers for their plane, you want to make sure that the carrier is TSA approved. This information you can probably find. A lot of carriers have a display that says it's TSA approved on it. Others you would have to just look up online, but it's much easier to have a TSA approved carrier prior to your trip. And of course, when you're traveling, if you have a brachycephalic animal, it's something just to be super aware of, that they don't do as well with travel or with many things. And what I mean by brachycephalic breed is a dog with a smushed in face, like a French bulldog, a pug, a Pekingese, you know, animals that are very flat faced, a Persian cat. These animals can overheat very easily. And again, we'll talk about that in the second half of the presentation, but airlines are very aware of this, and actually half of dog deaths associated with air travel over the past 5 years were brachycephalic dogs. Like, I'm sure people, if you've heard, you know, clickbait on the internet about, you know, my dog died at the airport, they're usually brachycephalic animals, which a lot of airlines have been getting wind of this, and they're actually putting restrictions on these dogs. So for example, Japan Airlines won't allow certain bulldogs on the plane at all. Lufthansa will only allow brachycephalic dogs to travel if the departure and the destination weather, like the temperature, is less than 80 degrees. So it's good to know this information if you have one of these pets prior to traveling, so that you don't get to the airport and then they tell you you can't go anywhere. So you also want to see if your animal can travel in the cabin. That would obviously be ideal. This really applies to cats and smaller dogs. And if you have a larger animal, they now are going to have to go into cargo. And if that's the issue, if that's the situation, you might want to consider boarding your pet if you're going away for a small period of time rather than bringing them, because flying in cargo is just a little bit of a less structured environment. There's no one watching them. You really don't know what the temperature is there, et cetera. And they're just there for, could be several hours. So if you're able to board them, that would be ideal. And another note about traveling on planes, especially traveling internationally, is that you want to make sure that you know the requirements of the state, or really the country that you're traveling to, many weeks prior to traveling, so that you can obtain the appropriate certificate of veterinary inspection, which they will for sure ask you for at the airport. And I can't tell you how many animals even come through the emergency room, which is not an appropriate use of the emergency room, but say like, I'm flying to France in 3 days and I need you to tell me that it's okay. I cannot tell you that. And it is such a process, and I can't even tell you. Each country has very different, very specific forms to fill out and very specific requirements. Like, even if your pet is up to date on rabies, they need one 10 days before you go, things like that. So it is your job as the pet owner to look that up to print all the documents and bring them to your appointment. It is not our job as veterinarians to know the requirements for every country in the world. And I can't stress that enough. Again, it sounds obvious, but it's not. Okay. And here's a new note about traveling by plane. And I'm sure a lot of people have heard about this recent change. So there's been a recent update on emotional support animals. And I think a lot of people were traveling by plane with their animals and labeling them as emotional support animals. A lot of them were legitimate emotional support animals. I think most of them were not. They were just getting their animal approved to be an emotional support animal on the internet or however they did it. But the airlines actually recently banned traveling with emotional support animals as service animals. So you can still take your animal on the plane, but they are not considered service animals. So they redefined what a service animal is. And it's basically an animal that is trained to work and perform a task for the benefit of a person with a disability. And they don't consider ESA animals that any longer, because I think a lot of people were taking advantage of it. And this rule went into effect at the beginning of this year in 2021. So again, pets can still fly. I think a lot of people are like, oh, I can't take my dog on the plane anymore. You can, you just have to pay for a ticket, and then based on their weight and breed restrictions, abide by them. So it's like you can't have a Great Dane in the cabin anymore, which a lot of people were doing. So here's just a note about a bunch of different, which I thought was funny, a bunch of different ESA animals that like people claimed were emotional support animals, and they took them on flights, and it was hard for the airlines to say no. A lot of them are birds. Here's a turkey, some penguins. This person flew with a chicken. In 2018, this peacock tried to board a United Airlines flight from Newark Airport. You know, I think that story actually, I saw it on the news. I'm sure a lot of you did too. I think that is sort of what like made people be like, wait a second, this is too unregulated and we need to do something about it. So that is a rule, and it did go into effect. So if you're used to taking your pet on the plane in that way, just know that you're going to have to buy them a ticket. It's just some general considerations when traveling, whether by, train, plane, whatever. You always want to bring your pet's medical records with you. And I know people are like, but I can just call my vet and ask them for them, and they can just digitally send them to me in most cases. That's true during daytime hours, but a lot of the times you're in the emergency room at midnight and your pet has tons of records and you're not going to be able to get them at that time. So before you leave during the daytime, make your regular veterinarian just email them to you, and then you have them forever in case something was to happen. You always want to pack a travel bag, medications, food, water, but you want to obviously bring it into the cabin with you and not check it. You never know what's going to happen. And if you think that your animal would require sedation, you want to talk to your veterinarian about that way before you plan on traveling. And I think ideally you would want to do a sedation trial prior to traveling, meaning that you actually want to administer that medication to your pet prior to that trip, so you can see how it is affecting them. Maybe it's making your animal too sedate. And if that happens in the middle of the ocean, you're like, oh my God, my dog, what's going on with him? He's so sedate. What do I mean? Freak out. So you want to know what dose of medication is going to affect your animal in what way. So just do a sedation trial, please, prior to traveling. You want to feed your pet at least 4 hours prior to traveling so they don't vomit in the middle of the aisle. I'm sure everyone would be fine with it, but you don't want that. And then I think another great tip for travel is exercising your pet prior to traveling on the day, like on the morning of travel. Like run your dog. If your dog is a runner, go on a run in the morning, play fetch, like go early to the park, like do something that makes them exhausted. They'll be much better travelers. It's like kids. Do some laps in the terminal, like do something that just makes them very tired. And of course, you always want to make sure your animal has proper identification. Your cat's proper identification. I think a lot of people forget that they need that too. And of course, that the carrier is clearly marked that there's like a live animal in there. Okay, so that was all about travel. Now that we're all out and about, and moving on to summer safety. I'm very happy it's about to be summer. Today was a beautiful day in New York City, and it made me excited to get out and also be out with my family and my animals. So things that we're going to talk about include, again, we talked about this earlier, never leaving your animal in a parked car, even if it's for 5 minutes. And I can't stress that enough. When it's 85 degrees outside, it can reach over 100 degrees in 10 minutes in your car. Like, it gets so hot in there. And I think people don't realize that. Even when it feels mild outside, it can get so warm in your car. And whenever I mean, I think we've all seen animals in a parked car, and it just like breaks my heart every time, because you never know when the owner is coming back. And even if you think you're coming back in 5 minutes, we've all been somewhere and gotten distracted and then forgotten. So please just never ever leave your animal in a parked car. You also want to just be very conscious of the humidity. I think a lot of people are very concerned about the temperature, but it's not just the temperature, it's the humidity also. Dogs, they pant to cool themselves. I think we all know that. They can't really sweat like people can. They can a little bit, but that's not the primary way that they expel heat. It's through panting. So when it's very humid outside, they're unable to expel heat effectively by panting, and they can become overheated much more easily. So an 80-degree day in New York City is very different than an 80-degree day in like Arizona. You know, it feels much hotter, and your dog is not able to expel heat as well. And another thing to think about just in the heat is sun exposure to your pet. And you can actually put sunblock on them to prevent burns and irritations to their skin. Dogs with thin hair coats, dogs with white hair coats, hairless animals are all more affected than darker animals. And then all dogs, though, really, like, their belly is very sparsely covered in hair in most cases. Their ears, their nose, all of those are prone to sunburn. In this top right corner, that's a dog with a sunburned nose. Like, that's real, can happen. But you can find products, which I'll show you later, to help prevent this from happening. Here's a good just visual from the ASPCA about leaving your animal in the car and how hot it can get. Here, I'm going to briefly mention something that I see very commonly in the emergency room called high-rise syndrome. I work in New York City. There's many tall buildings here. When it gets warmer out, people start opening up their windows, which is great, but also it puts their animals at risk of falling out of their windows. And I see cats fall out of windows every single day at my job, and it can be very sad and can be very severe. So high-rise syndrome is actually a term that was first coined at the Animal Medical Center in the 80s. It refers to injuries commonly seen in cats who fall from a height. And we see very typical injuries in these cats that come in. Like, sometimes people don't know what happened. They just find a cat on the floor. They're like, I don't know what happened. And then I look at it and I'm like, I know what happened because of these injuries. They're all very typical. So these cats can develop chest trauma. The most common chest trauma we see in these guys is something called a pneumothorax, where air from inside their lungs leaks out from their lungs into their chest cavity. They can also develop pulmonary contusions, which is bruising or bleeding inside the lungs. They develop head and facial injuries where they'll avulse some of their teeth. They'll develop jaw fractures. They can split their hard palate when you look in their mouth. And broken limbs. They can break all of their bones, their pelvis, all of their long bones, which is very sad. In addition to that, we can also see abdominal injury, like fracture of an organ and bleeding into the abdomen, and also pancreatic injury, which is like a sleeper injury that we don't always think about, but they can fracture their pancreas, and that can actually be very, very, very serious. What's good, even though this sounds very terrible, is that 90% of these cats will actually survive with veterinary care. That doesn't mean like your cat falls out of a building and you take it home. That means your cat falls out of a building and you take it to the vet, and then they'll survive. So don't just take that 90% and be like, he'll probably be fine. Like, take him home. But an interesting thing about high-rise syndrome is that in 1987, the AMC actually did a study. There are a lot of cats in the study, like 140 or something like that. And it showed that cats actually sustain more injuries if they fell from 6 stories. No, that should say 6 stories or higher, not lower, sorry. So it's suspected that if they fall from a greater height than 6 stories, they think that cats maybe can right themselves in the air and like be a cat, like land on their feet almost, and like sort of relax into the fall. Whereas if they fall from less than that, they're falling in like an awkward angle and they're tensing up and they can get more injured that way. However, I just did a lit search and I also found a paper from more recently in 2004 that also had a very large number of cats that said that they sustained injuries greater than 7 stories that are worse. So who knows? I can tell you from my personal experience that I see animals sustain all different types of injuries from all different heights. I've seen animals fall like 15 stories and be barely injured. And I've seen animals fall from very short heights and be severely injured, or animals that fall very high and very, very severely injured. So it's what to make of these, I'm not exactly sure, but AMC did have this famous study a while ago. But most importantly is that prevention is key. So especially if you have a cat, close your windows. And if you're going to open them, have bars on your windows or like a very serious screen on your windows. Because cats, if they want to do something, they'll like scratch through or do it. So if you make sure your screens are good. And then of course, ID your cats. If they fall, then at least if they get to the hospital, we can scan them, we can locate you, we can tell you that your animal is there. So many cats that come in as high rises come in as strays because people don't ID them. And then no cats on balconies. A lot of people love to take their cats on the balcony, and it's just like an open air situation. That's, to me, is very scary as a vet. Okay, so I think everyone also is aware that in the heat and humidity, especially with dogs, they're at risk for heat stroke. Heat stroke is a condition that we see in animals when they're not able to like expel heat effectively, either from the ambient temperature being too high, or from like exercise induced heat from just running them or exercising them when it's too warm out. And it really is seen when body temperatures are greater than 105 degrees. A normal temperature in an animal, a dog or a cat, is less than 103 degrees. I can't tell you how many people come in and tell me their animal has a fever and their temperature is 102.5. That's not a fever in these guys typically. It's higher than 103 is what I would consider a true fever. And when we see animals that have like heat stress or heat stroke, it's usually over 105 degrees. Signs that you would notice at home to detect that your animal is under heat stress is that your dog it's panting, he's very lethargic, he like collapses on the floor, he like can't get up. That can progress to vomiting and diarrhea. You look at their gums, they're very bright red or more cyanotic or like purplish color. That's no good. Or they develop ataxia or incoordination when they're walking. All of these things are concerning as a pet owner when it's warm outside. Animals that are at increased risk for this, because some animals can be outside in the heat and do very well and never have this problem. But I'd say in the emergency room, the ones that come to us very ill are animals that are significantly overweight, brachycephalic dogs. Again, very risky situation if you have one of these. And then dogs with underlying conditions that include like laryngeal paralysis, collapsing trachea dogs with brachycephalic airway syndrome, cardiovascular disease, etc. So all of these dogs are just more at risk. They're just not able to adapt to the temperature as well. So they start out doing those things that I just described, and then eventually, if they're significantly enough affected, they can develop very severe disease like organ failure, seizures, coagulopathies, acute kidney injury, and even sepsis. And in these cases, the prognosis is actually quite guarded. These dogs don't do very well always. It's really guarded. I never tell an owner that their animal's for sure going to do well. They can go many different ways. So 50% of them die within 24 hours of hospitalization. That's how severely affected these animals are. Another thing to know about your dogs is that it takes them on average about 60 days to acclimate to warmer temperatures. So they can't just like go outside in a t-shirt and shorts and be like, it's summer, like we can. They need time for their bodies to acclimate to warmer weather in areas where the weather changes dramatically. In New York, it's, spring one day and like literally summer the next day. There's no transition. So for them, it's very hard to acclimate. It takes a while, 2 months. So keep that in mind. So what I find interesting about this disease, and to tell pet owners about, is that there is actually something that you can do at home that is very helpful for your animals. So if you are worried that your animal is under heat stress, it comes in, it's outside, comes in, it like collapses and looks just panting, looks very uncomfortable, you can try to actually actively cool them at home. So you can spray them down with cool water, not freezing cold water. You can put a fan directly in front of them. We put a fan in front of all of these animals in the emergency room. It's such a basic thing, but if you have one, putting a fan right in front of them is very helpful to them. If they're able to drink water, provide them with water. You can actually use ice packs and put them like under their necks, in their inguinal or their groin region, or in their armpits. If you're going to do that, you want to remove them after 20 minutes, or if your pet starts shivering. And then you can actually monitor the rectal temperature at home with just a regular thermometer. And you want to cool them to 103 degrees. You don't want to cool them past that, because they can become too cold. They can go the opposite way and become hypothermic. And of course, if you're worried that your pet is undergoing this problem, they're not rebounding in a way that is appropriate, you bring them to us. But what's interesting is that studies show that mortality is actually decreased in animals that are actively cooled at home prior to arrival at a vet. So that's actually amazing. There are things that you can do in this case that can give your animal a better prognosis long term. But definitely come in, let us look at your animal, let us do a bunch of tests and make sure that they're not going to, or hopefully not going to progress, but cool them at home. Just do it. Like, it can't hurt them too much to try to actively cool them. And of course, just like with everything, prevention is key. So these are obvious things, but provide shade. If you have an animal, you should really have a room that has an air conditioning unit in it. Of course, water always. Do not exercise your pet in the heat. That also seems obvious, but so many people just don't know that. I once had a case of a French bulldog, a young French bulldog. He was like 2. The owner ran him in the middle of the summer day, literally took him for a run in the middle of the summer day, and he came in like horrible heat stroke. He survived. He was one of the 50% that survived, but he has permanent damage to his kidneys now. And, his life is probably lessened because of that. And he just was a loving owner. He literally did not know. So don't do that. If you recognize heat stress in your pet, take them inside, offer them water, try to cool them. You can always, trim their coats. And if you do exercise them, pick an exercise that also provides cooling, like running them in sprinklers, taking them swimming, put them in a doggy pool outside, like those sort of things. All the dog parks in New York now have a pool in the summer. So, and again, take them on long walks in the morning or in the evenings. If that's your routine, that's great. Do it when it's not super hot out. Okay, so here are some products that I think are good to have around the house in the summertime. One of these elevated dog beds allows a bunch of currents around your dog. One of these pools, these booties. I think a lot of people in New York have their booties on their dogs to prevent burning to their paw pads, or any irritation to their paw pads. If your dog won't wear the booties, there's actually this Musher secret, like this wax you can put on their paws that acts similarly. It like prevents the burn of their paws. It also keeps their paws like very moist. So it's also can be used in the winter for like snow and salt. And it's used in a bunch of sled dogs. So it's very effective. You can get it on Amazon. This is sunblock for your dog's nose. These popsicles, you can buy them, you can make them. This is a cooling pad for a bulldog. Like, have it around. If your dog feels warm, they can literally go sit on it. And a bunch of sunblock, which seems like you're like, that's not a real product. There's like 10 million different options on the internet. It's crazy. So these are all just good things to know about. Okay. Beach dangers. As everyone heads to the beach, a lot of people will bring their pets with them. There's a lot of beaches that allow dogs on the beach, either here or in California. People bring their dogs to the beach all the time. And I think a lot of people, what they don't think about is the danger of the sand at the beach. I know that sounds like overly cautious, but I've seen like so many dogs come in with sand impaction from just normal play at the beach. The owner is playing fetch with them. They go and get the ball, get the stick, but they're also, as they pick it up in the sand, they're ingesting sand. So sand impaction can be a life-threatening emergency. It is something that has a very characteristic appearance to veterinarians on X-ray. Typically what owners will notice at home is that their animal is vomiting, they don't want to eat, they seem very lethargic. This usually happens, 12 to 24 hours, sometimes 48 hours after they're playing fetch, but owners never make that association. The only time we are like, were you at the beach, is when we take these X-rays and we see this sand in their intestine. So in the top right, that's a picture of a dog's abdomen. That like white, almost like sausage-like appearance is actually sand in the intestines, causing an actual like GI obstruction, preventing normal peristaltic movement of the intestine. So it is a very classic thing, but it can be very dangerous. Animals come in obstructed, just like if your animal ate a sock and it was stuck in their intestines. But what's different about those two things is that with sand impaction, we actually typically try to manage these dogs medically, meaning that we don't rush them to surgery like we would an animal with a sock or another type of obstruction in their GI tract. And these dogs actually do quite well with medical management, meaning like fluids, time, walking. We do a lot of walking in these dogs to help their GI motility, and anti-nausea medications, and just like serial monitoring and serial radiographs to make sure that the sand is moving through into their colon. Very rarely do we have to take these dogs to surgery. There's a lot of risk for taking them to surgery because sand, there's like a billion particles of dirty sand that your surgeon would have to remove. And it's a very dirty thing. Everyone tries to, surgeons are the cleanest people in the world, but you can't control a billion pieces of sand in the way that you would like to. So there's just increased risk of taking these guys to surgery, and they usually do very well with medical management. So it's good to just know that as an owner, if you have to go someplace else and they want to take your pet to surgery, know that perhaps medical management is actually an option for these guys. Another thing about going to the beach is just like the crap that's all over the beach that everyone sees everywhere, and dogs are obviously very curious. I've removed dead birds and fish from my dog's mouth many times. So typically if they eat those things, it can cause GI upset, vomiting, diarrhea. They can eat something that actually causes an obstruction or an esophageal obstruction. Here's a radiograph of a dog that ingested 2 fishing hooks that's actually lodged in his esophagus. Of course, with fishing hooks, we always worry about the fishing line that's on there. It can also cause a linear foreign body. There's a lot of considerations there, but these can be very difficult to remove in an animal's esophagus for sure. Here's a dog that came in and got a fishing hook stuck in his lip. This seems like something that an owner, you're like, I can take that out. Not a problem. They're impossible to take out. They are barbed in like the other way. So if you try to, it'll rip your animal's lip out, and there's no way in most cases that they'll allow you to do that. So when I see these dogs, which I've seen a couple, you actually need to like fully sedate them, sometimes even anesthetize them, and cut the hook and back it out. You can't pull it out. So these animals need to come in. Okay, so here's something I think a lot of people, along with sand ingestion, a lot of people don't think that just seawater can potentially be dangerous to your dog. Also, a lot of people play fetch with their dog in the ocean, and as they are, getting that ball or stick or whatever, they're also ingesting a lot of salt water. So if that happens, your dog is at risk for developing saltwater toxicity. It's not super common, but I have seen it a couple of times. The ocean is very salty. As we all know, it contains 3.5% sodium, which is a lot of salt. A normal sodium in your blood and in your dog's blood is around like 140 to like 155, something like that. And hypernatremia or high sodium is considered when that value reaches above 160. We typically see signs when that value gets to be above 170. These signs typically occur very acutely. So it's not like your dog goes to the beach, plays fetch in the ocean, and then a week later your dog develops these signs. They typically happen within hours of them going to the beach. And what people notice at home is that your dog is obviously very thirsty. Just if you or I had ordered to eat something salty, your body's first reaction is to drink water to regulate that increased sodium in your body. It can progress to vomiting, diarrhea, ataxia, meaning that uncoordinated gait or walk, weakness, muscle fasciculations, and even seizures. Typically, though, your dog can regulate small increases in sodium themselves by drinking fresh water. And I think that's just another reminder that when you bring your dog to the beach, even for a short period of time, you must have like a lot of water, because if your dog plays fetch in the ocean, drinks a lot of salt water, and he's unable to drink and regulate his sodium with fresh water, that's when we can get in trouble, because the dog should be able to fix it himself if he has adequate water available. And if you notice any of these signs, obviously seek medical attention immediately. This is something that is, if you know what to look for and know how to treat it, it is very treatable. It's like I've seen a dog come in like actively seizuring secondary to saltwater ingestion, and he went home the next day or the day after with treatment. So as long as it's recognizable and the veterinarian knows what to do, it is very treatable. Okay, so the next big holiday that's coming up is the 4th of July, and I think we all know what that means, especially if you're a pet owner. It means fireworks, and if a lot of people have animals with fireworks phobia, I think that's what a lot of people are focused on. I had a dog that had very bad fireworks phobia for the past, when I was in veterinary school, and every time it was the 4th of July, like I only thought about her being scared on the 4th of July, and it still makes me sad. So some tips, if you have one of these pets, is to keep your pet inside. That seems very obvious, but I think a lot of people want their animal to like engage in the party or the fun, but it's actually much safer for them to be inside and feel like they're in an environment where they feel safe. Of course, keep your windows closed. The same thing up with your cat. Your cat will bolt out the window on the 4th of July. It's the #1 day for animals to be lost in America is the 4th of July. So just keep that in mind. The door is open, people are coming in and out. Another way for your dog to just like bolt out the door. You want to make sure your pet has a safe place. Like if your cat loves to be in the closet when they're scared, don't close the closet. If your dog loves to be in a room, don't have that be the room that you have a party in. Just be considerate of these things, because they like to retreat to places that they feel safe. You always want to make sure your pets have proper ID. I've said this like a million times, but especially your cats on these days, ID your cats on the 4th of July at the very least, so that if they do get out, we can identify them. And then again, consider tiring your pet out that day. Like run your dog in the morning, play fetch, do exercise that makes them too tired to react to the noise. And of course, you can always consider medications. Again, contact your vet. Again, do a trial prior to the event. I had to sedate my dog every year. I knew I had to, because there was nothing that I could possibly do to make her comfortable in the situation, and it really helped. So, but definitely talk to your vet. Benadryl is not going to do it. Like they usually need like, real sedation. You can also try like noise, like white noise, or put the TV on, like something to distract them. People have a lot of success with a thunder shirt, treats, or like some sort of distraction toy or calming supplements. It depends on your pet, but when I had a dog like this, none of that. She wasn't hearing any of it. With, parties and summer comes a bunch of barbecues and picnics, and with that obviously comes food. And it seems really obvious to me to like not give these things to your pets, but so many people do anyway. I think they just don't know, and they want their animal to participate in the fun and in like the good time. So please don't give your dogs corn cobs. They basically get stuck all the time. Like it's crazy how many people just feed their dog a corn cob. I think they think that they'll like eat it like a cartoon or something and like just leave the cob, but your dog is not going to do that. They're going to eat the cob, and then they very commonly cause GI obstructions. They do not dissolve at all. So here's in the bottom right corner, here's a dog that ate a corn cob, and you can see in that circled area like a very characteristic corn cob appearance on radiographs. They always look like this, and if you've seen it once, you'll see it a million times. So do not give your dogs a corn cob. Avoid grapes and raisins. They can cause acute kidney injury in dogs and in cats. This reaction is what we call idiosyncratic, meaning that not every dog is affected. So some dogs can eat grapes their whole lives and be totally fine. Other dogs can have one grapes and be very severely affected. There's no way to know which dogs will go one way or another. So we treat them all the same way. We all treat them like they are going to develop a toxicity in the emergency room. But in actuality, a recent paper actually said that about 6% of grape ingestion causes acute kidney injury. So 94% of these animals are fine, but you never know which way your dog is going to fall. So you have to treat it like it's going to cause a problem, but just don't give them. But you know, I'm sure my kids have given my dog grapes before. I'm just not blocking it out. So peaches, plums, that's the same thing as corn cobs. Really, the pit can cause a GI obstruction. Skewers are something I think a lot of people just don't think about. No one's going to give their dog a skewer, but they can jump up on the table and retrieve one. And these skewers can actually migrate in the esophagus. They can go into the chest. They can cause GI perforation. They can literally end up in all different cavities in your animal's body at different periods of time. It doesn't always just happen immediately. It can happen weeks later. So skewers are bad. Bones, very common. Ribs, chicken. They can typically, when your animal ingests these things, the worst thing that happens is that they develop gastrointestinal upset. Sometimes they can develop an esophageal obstruction. I am always hyper aware of esophageal obstructions when a dog eats a bone, but they can be actually really difficult to diagnose because your dog will have vague clinical signs. They can't just be like, there's something in my throat. They can't tell you that. So what they will look like is just, they'll look weird, is really what a lot of people are saying, my dog's off, he's hacking a little bit. Sometimes they drool excessively. They won't eat. Sometimes they regurgitate, but their signs are typically very vague, honestly. And sometimes we'll see animals with an esophageal foreign body that's been there for many days, and those typically don't do as well as if we remove it right away. So in bones, I'm always very worried about esophageal obstruction. What's good is if the bone makes it into your dog's stomach, is that they are typically highly digestible. So all types of bones are usually very digestible once it gets into the stomach. Your dog's pH of their stomach is less than ours. It's very low, and they are very good at digesting bones. Another thing about barbecues and picnics, any high fat, greasy food can lead to GI upset or later pancreatitis, which is a disease that can sort of range in severity from being fairly mild to being very, very severe. And again, you don't know which way your dog is going to go. So just any fatty food is not a good idea to feed your dog. Going back to the bones thing, because I think a lot of people come into the emergency room after their dog ingests a bone. I'm just going to show you an example of why that's not always necessary unless your animal is clinical, meaning that they've actually shown some signs of being ill or uncomfortable. Here's a dog that ate a bone. The owner saw it eat the bone. She immediately brought it to her local vet. This is not a radiograph that we took. The radiograph showed this, you can see this very large, I don't know if you can see my cursor, but this very large bone is transversing this dog's stomach. This is a small dog. It's like a Yorkie. It was a Yorkie or something, small Chihuahua. And the vet got scared. That's a very large bone to be in this dog's stomach. And he referred it to us for endoscopy, like a scope, to go in there with a camera, anesthetize the dog, and remove the bone. And here is actually that dog's radiographs 12 hours later with no scope. So this was my case that came to me, and I was like, do we risk anesthetizing this dog? I'm sure it would have been fine, but anesthetizing the dog, going in with a scope, which carries its own, though mild, risks, or do we just wait and see what happens to this bone in this dog's very acidic stomach 12 hours later? So this is a radiograph from the same dog 12 hours later, and you can see that the bone is completely dissolved. The dog was not clinical, meaning it was not vomiting. It was literally wagging its tail. It was so happy that it just ate this bone, and it wasn't sick. So we elected to wait and watch and just see what would happen. And in this case, the bone was dissolved. And that is what happens in many cases. If your dog is vomiting, if your dog is not eating, if your dog is regurgitating, any of those things that I mentioned previously, obviously bring it in. I've had so many people be like, my dog, I just watched him eat a whole chicken off of the counter. Help me, I'm freaking out. I'm like, And the dog is like a lab, very happy that he ate this whole chicken. And like, truly, there's nothing to do. Like, he's going to just eat that chicken, digest the chicken, unless he develops vomiting diarrhea, you can bring him back, but there's nothing to do. Usually they're fine. So just a good note about bones, that they're usually not that bad. Very rarely they can cause GI obstruction, very rarely. Okay. Oh no, hold on. Okay. So another thing that comes with summer is that your dogs usually are more outside and has more exposure to different parasites that exist around the tri-state area. So I think all of us are hypersensitive to Lyme disease. It's something that people get, and everyone knows that it's about it. And your dogs can get it too. It's a tick-borne disease, and it's actually caused by a bacteria that lives inside the tick. And in the Northeast, about 10 to 25% of ticks carry this bacteria, which is a lot of ticks. It's transmitted by a very specific type of tick called the Zoodes tick, and there's different sort of types of those depending on the area in the United States. But what I think a lot of people don't know is that it actually takes 1 to 2 days for that tick to transmit Lyme disease to your pet. So that tick needs to be feeding on your animal for, that is a long time, 1 to 2 days before transmitting disease. So if your animal goes to the woods and you go on a hike on Saturday and then you find a tick Saturday night, remove it, the chance that your animal is going to get Lyme disease is very low because it wasn't attached long enough. So in animals, Lyme disease is different in that typically it causes fairly mild signs in dogs compared to people. And another thing that's great about it in dogs is that it usually responds very well to antibiotic therapy. So in people, there's reports that it can be a more chronic disease. In dogs, it doesn't typically manifest that way. There's also a difference in animals between exposure to Lyme disease versus infection. And I think that's something that more vets should be a little bit clearer about. So once the tick bites your pet, the bacteria, it can enter your pet's bloodstream, and your pet can do one of two things. It can either clear the bacteria or they can become actively infected. And this is something that usually happens several weeks after the tick is bit. Your animal will not test positive for Lyme disease like 2 days after you find a tick on them, unless they were infected with Lyme disease, 4 weeks prior to that. So going to your vet after you find a tick is not, the test that they do is not going to be accurate for that tick bite, if that makes any sense. You want to go to your vet a month later. Your vet, a month later, you'll go and your vet will do a test typically called a 4DX test, which is an in-house test where they take some blood and put it in it's called a SNAP test, and they'll do it usually in the office, and it tests for 4 different types of disease, tick-borne disease, one being Lyme. And if your dog tests positive for that, what it's actually testing for is exposure, not active infection. So if your dog tests positive for that, your vet should then submit another blood test called a Lyme C6 test. And what that test is doing, it's basically differentiating between exposure versus infection. Because treatment for these, although it's very effective, it's also a month of antibiotic therapy. And it's not something that you just want to like give your dog for a month. You don't want to put them on an antibiotic for a month if it's not necessary. So if your C6 test comes back and the numbers are low, indicating just exposure and not infection, we wouldn't treat that, because that just means that your dog beat the infection by himself. He was never really infected. His body recognized it and it wasn't a problem for him. If your dog is actively infected and that C6 test comes back high, then we will institute treatment. So it's a good thing to know that even if your dog snaps positive, that doesn't mean that your dog is actively infected. And there's another test that your vet should do to make sure that that's the case. Only 5 to 10% of dogs that actually are actively infected show signs. So it's good to routinely test your animals for this problem. That's why that is great screening test. Dogs that have Lyme, an active infection, and they show signs, they typically come in with fever, a lameness, usually a shifting leg lameness, where one leg will be lame one day and then another leg will be lame another day. They can develop a lymphadenopathy, like swelling of their lymph nodes, or joint swelling. What's good is that, again, it's very responsive to antibiotic therapy and it rarely causes serious disease in dogs. But in a very small percentage of dogs, 1 to 2%, it can cause acute kidney injury and then cause like a protein losing nephropathy. And it can, in those dogs, it is very serious and they can definitely die from that and become very sick from it, but it's very rare. And this is usually seen in Lamb's retrievers or Bernese Mountain Dogs. And there's something about those dogs that just makes them more prone to this development of Lyme disease. Another thing to know is that a lot of people come in saying that their dog has a bullseye rash. That's something that's very, very uncommon in animals. In people, 80% of people that are infected with Lyme will develop the bullseye rash. In dogs, it's like very low. So they typically don't have that characteristic rash that are seen in people. I'm just going to briefly talk about the two other tick-borne diseases that are also on that SNAP test. Ehrlichia is also a bacterial disease transmitted by ticks. Again, the tick would need to be attached for 1 to 2 days before disease transmission. The signs are very similar to Lyme. The signs are all very similar. Lethargy, fever, weight loss, because this can be sort of more long-standing disease. Sometimes they can develop vomiting, diarrhea. In this case, they can develop low platelet counts. This is way more prevalent in the South. It's not typically something we see in the Northeast, but I have seen it before. Another disease that we do see more commonly here is anaplasmosis, and commonly concurrent infection with Lyme because the same type of tick transmits both diseases. Again, the signs are very similar. And in this case, dogs are usually clinical within 1 to 2 weeks of infection. So if your dog tests positive for anaplasma, and they're aclinical, they have none of these signs, it was just found on a routine SNAP test, which a lot of vets do, rightfully so, there's no reason to treat it because, again, it just means that they were exposed to it, but they're not actively infected. So dogs will be clinical within 1 to 2 weeks of infection. And here are the most common places to look for ticks on your dogs. And I think this is super. Every time my dog goes outside, I look in these places and I occasionally will find ticks inside the ears, the toes, like open your dog's toes to find them in the groin, in their neck area, near their eyelids, so just look in these areas, and you can always Google this if you forget where, but it's important. And then to talk about mosquitoes, which are very common during the summer months here. And I think a lot of people don't know that. Everyone knows about heartworm and that they should give their animals heartworm prevention, but a lot of people don't know that mosquitoes are actually the insect that transmits heartworm, and they can transmit it to dogs, to cats, and actually to ferrets. Dogs are the natural host, and cats are atypical hosts, meaning that in dogs, heartworms can actually mate and make more heartworm, and in cats, they can't do that. So it's sort of like a dead end host for them. Because dogs are natural hosts for heartworm, that can lead to like hundreds and hundreds of heartworms in dogs. And they like to live in their hearts, in their lungs, and in their major arteries. And this can obviously cause major problems to their cardiovascular system, long-lasting disease, and even death in some cases. In cats, it's different. And I guess I think it's just interesting how the disease is so different in both of these animals. In cats, because they're not natural hosts, they don't have a large worm burden typically they'll only have like 1 to 3 adult worms, and sometimes even 0 adult worms, and the problem is actually caused by the immature worms, or like the larva, and that can lead usually to severe respiratory disease in cats, whereas in dogs we see right-sided heart disease. Typically in cats, it's usually like this respiratory disease that they develop. And in cats, unfortunately, it can be sort of difficult to treat. And sometimes we actually don't treat it because you just have to monitor them and like wait for the adult worms to die, because the medications used to treat it in dogs are not tolerated in cats. The side effects are so severe that it's more dangerous to treat them. But in in both of these cases, prevention is key. Giving your dog monthly heartworm medication prevents this from happening, like full stop, and it's 100% worth it to do it. Although heartworm disease is not as common in the Northeast, it is something that we see. Like this map here just reminds me, this is a map from 2 years ago. If you look at New York State and then you look in like New York City and around that area, some clinics see between 6 and 25 cases per clinic per year, which is a lot. So it's something to consider. You want to give your animal heartworm medication all year round. I set a reminder in my phone and it dings me once a month and it reminds me to do it. And I think it's much easier giving it routinely than just turning it on for the summer months, because you just won't remember. At least I won't remember. So it's just something in my phone that goes off. Or if you have a calendar, like put a sticker, put a heart there, do something. Oh, okay. And that is the end. And this is my own dog. He is a brachycephalic dog, so I know a lot about that. His name's Hank. This is him on the underwater treadmill upstairs in our rehab.
Oh, Hank.
I know.
So cute.
Really working it.
Okay. All right, well, thank you. This was so thorough and comprehensive, and really, really appreciate it. And we had one comment, Kathy, or question saying, or will we receive a copy to share with others? And absolutely. And please, please do share it with others, because I feel like so much of this is preventable, but people just don't know. And I had shared that my dog, the first year I had him, we were at the beach playing fetch with my nephew over and over again, and ended up with severe sand impaction. And, you know, it just, thankfully he was okay and they were able to treat him medically, but it happens, you know, and the vet up in Connecticut was saying it happens very, very often. And just, I think it's just knowing about it is enough to prevent it sometimes. So again, thank you again. And we have a bunch of questions, so we're going to go through them. We have some questions about coats, double coated dogs. Is it true that the undercoat keeps the heat out to some degree?
Yeah. So when I saw, I knew that I was like, perhaps people were going to ask that, because different breeds, sometimes the double coat, allows them to expel heat better. So don't shave, like when I say trim your dog's fur, I don't mean like shave them to their skin, like just trim the fur down and they'll still have their undercoat.
Great.
So,
and on that note, yeah, a question also about a dog with hair, not fur, cooler when the hair is fairly short, or should it be left longer?
Right. Just trim it. Yeah. Just don't shave. Like a lot of people, they'll go to the groomer and then they'll come back and they'll like be naked. Like just tell them to just trim the hair, not to like shave it to their body. Because yes, it does work like that in some dogs where it's actually, that's how they keep cool. But just don't shave them.
Don't shave it. And cats, we have a question about, should Maine Coons be shaved for the summer?
I mean, it depends.
Matted.
Yeah, I mean, if your cat gets matted, a lot of people will shave their cats in the summer and do like that lion cut, which I find to be very cute. For a lot of Persians, people, if your cat gets matted, and some cats just won't allow you to groom them. Some cats are too fat to groom themselves effectively. Shaving them is totally fine. Yeah.
Great. Okay. Car rides, would a harness work rather than a crate?
Yeah, that's totally fine. Depends on your dog. Yeah.
Okay. And then the same response in cats regarding ticks. Is this, yeah, you went through that, but yeah.
Yeah. Those diseases are not seen in cats, really.
I mean,
they can get different tick-borne disease.
I mean, in terms of prevention for cats, I mean,
but prevention,
still want to give them.
Yeah, like you can give them like monthly revolution and things like that. And if you have a cat and no dogs, like the chance of them having tick exposure, if they're indoor cats, is extremely low. But if you have a dog that goes outside, those are the people that should be medicating your cats, really. Or if you are a hyper. Okay. Yeah, there's monthly preventative that prevents them from tick-borne disease as well.
Okay, no, that's good to know. And then this is good. We actually did something on removing a tick, but just talking a little bit about that, if you would, about how to remove it. I know, don't twist.
Yeah, right? So what I usually tell people is actually, if you go on YouTube, you can watch like a good video of it and it really helps you. There are actually also tools that are tick removing tools in dogs, and it just like allows you to pop them off that you can get, and they're really inexpensive. They're almost like spoons, but ideally you want to grip them right at their insertion site into your dog's skin, like right at the head, and just pull directly out in a very straight, don't be scared. Like I think a lot of people get very hesitant, but you're not going to hurt your animal. You're just going to remove the tick effectively. And I think also a lot of people, I've seen so many people come in the emergency room when they are scared that the head is left in their body. That's fine. It's fine. It can be irritating, but your dog will expel the tick's head eventually, but it's never like causes a major problem. It's just like a little gross and it can be a little irritating, but don't freak out about that. If you take off their body and not their head, you're still preventing them from transmitting disease. So it's better than nothing.
Okay, great. This is a good question as well. Does giving my dog flea and tick monthly medication prevent ticks from getting on my dog, or just prevents the illness?
So it really just prevents, so it depends which one you use. And there's so many of them that like I can barely even, like I don't even know which ones do what at this point, honestly, because there's so many on the market, but generally they prevent disease transmission. So if it doesn't prevent them from getting on your pet, but if they bite your pet, it will kill them before they're able to transmit disease. That is how they work in most cases. Like the Seresto collar, it repels ticks. That's I know that one actually like prevents ticks from getting on your pet. And then I actually think topical Frontline and those things, I think they also help repel, but the oral ones, which are way more common nowadays, which are super effective at preventing transmission of disease, which is really our biggest concern, just prevents disease transmission, and it kills the tick prior to that.
Okay, no, that's good to know. Let's see. So, we have a question about lepto in creeks or rivers.
Yeah, so lepto is typically, it's very common in New York City. We see lepto all the time. And what's good is that because creeks and rivers are running water, it's less commonly seen there. Lepto is transmitted by rodent urine. So New York is like a rodent urine festival because there's rats and mice everywhere. And it's also stagnant pools of water. And, you know, my dog will like lick pee and water, like who knows what he's licking, and rodents urinate in those puddles all the time in New York City. So it's very common here. Creeks, rivers, less so because it's moving water. So it's not as prevalent.
So do you recommend the lepto vaccine?
I do, very much so. It should be a core vaccine. In New York, I vaccinate, I mean, I don't vaccinate that many animals because it's not my job, but right. All of the New York veterinarians routinely vaccinate for leptospirosis. If you're in a lepto endemic area, you should for sure vaccinate for it. It is a deadly disease.
Okay, no, good. What about using like human or baby insect repellent on dogs? Not good, right? Or
I mean, I guess it can be, I don't know. I guess there's probably dog insect, or maybe there's dog insect repellent. I probably haven't really looked for that before, but I don't know if just don't spray it in their eyes, and I would watch for skin reaction. I don't necessarily think that would be that bad for them.
Maybe wash it off so they don't lick it later.
Yeah, like
I admit I've used it before.
Yeah, I don't know how, I'm not sure how effective it is.
Right.
Like, I think giving them the monthly preventatives
definitely
are important.
Better. Okay, sunscreen, licking the sunscreen off their nose. You have a question?
I imagine that the animal products would be safe for them. I would assume that's why those are different than human sunscreens, but I don't know individually those companies, obviously, what they would put in there, but I think it's probably fine.
Yeah, I think there's how can you prevent it? Maybe, from
licking?
Yeah.
Oh, you can't.
You can't, of course not.
No.
Put more on, right? Yeah.
No, yeah, you can't. I'm sorry. I wish I knew what that. No.
Okay. Calming supplements for cats. I know it's probably individual. Traveling to the vet for annual checkup. They're asking.
There are truly, if your cat needs something to help calm it down on the way to the vet, talk to your vet about giving your cat gabapentin.
Okay.
Because it's effective. You can try, there's so many different calming supplements on the market. You can try them and see how effective they are in your cat, but a lot of them, I don't know, how effective they are, honestly. But gabapentin is a very safe, effective medication to help with pre-travel, like pre-vet anxiety in cats. And I would talk to your vet about it for sure, because I'm sure they'll be happy to give it. It's easier for them to deal with your cat. So a lot of vets are very happy to use it.
Great. Okay. Someone else is asking, seriously, you put sunscreen on your dog's nose? But yeah, it can be helpful, right?
No, but if your dog has like a pink, especially if your dog has like a pink nose, it could totally get burned. I know it seems crazy, but.
What about doggles, like the glass? Like,
I don't think you need, unless your dog, I guess if your dog is one of those that sticks his head out of the window and you can't prevent it,
well, you can
close the window, but
for the sun, not necessary.
It depends. So if your dog has like panis, which is a very specific ocular disease, then they need doggles, because I think UV light can make it worse. I'm not an ophthalmologist, but a lot of dogs that have that specific condition use doggles and need them.
Okay. Well, that's good to know. Cyanobacteria cases.
I've never seen one before.
Never seen one. Okay.
How about that?
That's good. Okay.
Not knowingly.
Right. Hopefully not.
Yeah.
Okay. All right. Well, anyone else have any questions? I know we're already over time. But thank you again. Thank you. Wait, should an indoor cat have heartworm meds? Oh, now more coming. Couple more, and then we'll wrap up. But
the answer I have is yeah. Yes is the answer. Your indoor cat should have heartworm medication, because mosquitoes can get inside your house, honestly. And it also, the cat heartworm medication, a lot of the times it will deworm them. It's just like a good monthly thing to do for your cat. So the answer is yes.
All right. Well, we have lots of everyone saying thank you so much. It's awesome. It's terrific. Thank you. And I agree. Thank you again, Dr. Fox, for giving us your time again. And we appreciate this. Is so informative. And please, everyone, spread the word about this and pass along the presentation. And have a wonderful night. And we will see you next time. Bye-bye, guys.
Bye.
Thank you.